Menopause is a word that most women are afraid of. As women age, certain disruptions occur in the body. Their hormonal balance changes. And the scariest part is that this significantly accelerates the aging process and the onset of diseases. In other words, a woman literally starts to wither. She loses her youth and beauty, her skin becomes saggy, and her health begins to deteriorate. At first, women get scared, but then they accept it as a given because they think there's nothing they can do about it. It's just time. Now we're going to get old. But in reality, it's not inevitable. You can maintain your beauty, health, and energy even during menopause. My name is Dr. Alice, and today I'll tell you exactly what happens in a woman's body during menopause, how to recognize that menopause is approaching, and what will happen if you ignore menopause. And what steps do you need to take to regain youth, beauty, and energy even during menopause? Watch this video until the end to understand how to act and not fall into the menopause trap. So what are the first signs that menopause is approaching? The first, of course, is irregularities in the menstrual cycle. When the cycle becomes irregular, there may be heavy or scanty bleeding. All of this indicates that hormonal changes are taking place. At the same time, emotional changes also occur. A woman notices that her mood starts to swing. Sometimes she's in a good mood, other times in a bad one. Anxiety and depression may appear. All of this is also related to certain hormonal changes. This can also manifest as certain physical symptoms, such as hot flashes, night sweats, and facial flushing. Often, the skin and mucous membranes lose moisture, become dry, and may even start to itch. Many women also notice a decrease in their energy and concentration. This is also related to the sharp drop in estrogen during the approach of menopause, because the functioning of the brain depends on estrogen. That's why concentration, memory, and your mental stamina are also connected to estrogen. The same goes for physical activity. During menopause, women's physical endurance also suffers greatly. And this whole cascade of negative reactions in the body leads to a slower metabolism and fat starting to redistribute differently. First of all, the pounds start to stick faster and it's harder to get rid of them. And secondly, fat often begins to concentrate around the waist. And of course, this is all related to hormonal changes. The thing is, it's estrogen that regulates where fat will be stored. If a woman has a lot of estrogen, fat is deposited in the gynoid pattern, that is, around the hips and legs. But if estrogen levels start to drop, male hormones begin to dominate in women, and fat redistribution occurs toward the abdomen, which is more of a male pattern. As a result, the waist changes, and a woman's figure changes as well. And what I just listed are only the visible symptoms. In reality, that's just the tip of the iceberg. Inside the body, truly massive changes are taking place. And estrogen is responsible for youthfulness and for the suppleness and elasticity of all tissues. If estrogen drops to a critical level, the skin starts to age more quickly. That is, collagen starts to break down rapidly, the skin loses its density, and many wrinkles appear. Blood vessels become fragile, and as a result, hypertension can develop, as well as atherosclerosis, because estrogen is also responsible for the elasticity of blood vessels. Let's move on. If there's not enough estrogen, osteoporosis develops. In other words, the bones become very weak. As a result, especially in women, bones often break as they age. You may have heard stories of women who fell and broke their hip or fractured their humerus. All of this is related to the fact that bones become brittle due to low estrogen. This can also trigger diabetes, obesity, and many other different diseases. So what can be done about all this to avoid these negative consequences? Let me be honest. Of course, the body ages, and we can't completely stop this process. But we can significantly slow it down if we follow certain steps, which I will talk about next. And every step I will mention next is scientifically proven. The first important point to pay attention to during menopause is metabolism. The thing is, if you had bad habits before and did nothing about them, then with the onset of menopause, their destructive effects will be many times greater. Why does this happen? The thing is, estrogen acts like a protective shield. It protects your blood vessels from negative influences. As I mentioned before, blood vessels become more fragile and stiffer. As a result, they can deteriorate more quickly. This happens because the lipid profile changes and a lot of bad cholesterol appears. Due to the development of insulin resistance, meaning that with the onset of menopause, the sensitivity of cells to insulin also decreases. Menopause is also associated with changes in fat metabolism, which can lead to obesity, and due to the increased stiffness and fragility of blood vessels, blood pressure also rises. So, these four factors significantly accelerate the aging process and increase the risk of diseases. That's why, with the onset of menopause, it's very important to reconsider your lifestyle because it will directly affect how quickly you continue to age. So, what can be done about this from a scientific standpoint? You need to adjust your diet. What does this adjustment consist of? Well, first of all, you need to make sure your body gets enough protein, because as you age, your muscles literally start to waste away. And people with a low percentage of muscle mass tend to get sick more often, they break bones more frequently, and overall, their life expectancy is lower. You should consume at least 1 gram of protein per kilogram of body weight, of body mass. So, if you weigh 60 kilograms, you need to eat at least 60 grams of protein per day. This will help maintain your muscle strength and muscle mass. Moving on, you need to reduce the amount of bad fats. First and foremost, you should stop eating all kinds of trans fats and cut down on animal fats, because animal fats, and especially trans fats, which are found in processed foods, are sources of inflammation. And if your body is experiencing ongoing inflammation, then, again, your blood vessels, your skin, everything starts to age faster, especially considering that we no longer have our protector, estrogen. As a result, all degenerative processes speed up. It's scientifically proven. There are plenty of articles that during menopause, it's best to follow a Mediterranean diet. This diet contains healthy fats and micronutrients, all of which support your health. For example, the Mediterranean diet includes olive oil and lots of seafood, and these fats, like olive oil, have powerful antioxidant and anti-inflammatory effects. The next important point is controlling sugar and glycemic index. The thing is, sugar is the main factor in inflammation and accelerated aging, because sugar causes large fluctuations in insulin and blood glucose, which in turn speeds up all inflammatory processes. And if you don't adjust your sugar intake and eat a lot of fast-digesting carbs, it leads to insulin resistance. This is when the cells stop responding to insulin. If this mechanism breaks down and the cells become insensitive to insulin, type 2 diabetes develops. This carries a high risk of cardiovascular disease and premature death. That's why you should start adjusting your lifestyle now and give preference to foods with a low glycemic index. These are the foods that contain less sugar and are absorbed more slowly. During menopause, all foods with antioxidant properties become even more essential. Basically, antioxidants are found in vegetables and fruits. These are all necessary to fight inflammatory processes in the body and to prevent our cells, tissues, and organs from breaking down quickly. Because it is antioxidants that capture all these harmful substances, free oxygen radicals, which destroy cell DNA and cell membranes. And that's actually what leads to many different diseases. So, eat vegetables and fruits that are rich in vitamin C and vitamin E. All of this will help prolong your youth. Next, since estrogen also regulates bone density, it becomes very important to additionally consume calcium and vitamin D, because after menopause, bones literally start to dissolve. This process happens very quickly. No diet can fully compensate for these deficiencies. That's why it's important to consume calcium, vitamin D, and vitamin K2, because all three of these components increase bone density. The next thing you need to take care of is physical activity. Now you'll probably say, well, that's obvious, of course. But actually, it's not all that obvious. There are some important nuances you need to pay attention to in order to get results. There are international guidelines that state women in menopause should spend at least 150 minutes per week on aerobic cardio exercises. Well, basically, that means brisk walking. And do 2 strength training sessions a week. Even if you have some stiffness in your spine, even if you don't feel as young as you used to, despite all that, you need to do strength training with dumbbells, your own body weight, squats, because it's strength training specifically that stimulates muscle mass growth. According to scientific research, it's strength training that slows down the process of bone resorption. Because if our musculoskeletal system doesn't get enough load, the bones get the message that, okay, if there aren't going to be any serious physical demands, then we can reduce bone density. I'll give you an example with astronauts. In space, there's no gravity, and if an astronaut doesn't exercise, their bones start to dissolve. That's exactly why even in space, it's so important to do strength training. So just imagine how much more important it is for women in menopause. It's simply a necessity. And as a fact, I'll mention there's a meta-analysis that reviewed 80 scientific studies involving about 5,500 women. And everywhere it was noted that with physical activity, with strength training, bone density increases. There are actually many different exercises that help maintain your health and youth. I also show a lot of specific, targeted techniques on my Body Secrets course for solving problems that can even arise during menopause. So if you don't know exactly what you need to do, join my course, link below in description. The third important step you need to take during menopause is to take phytoestrogens. The main classes of phytoestrogens are soybeans, whole grains, flax seeds, and legumes. The most well-studied phytoestrogen for combating menopause symptoms is soybeans. And there are also many scientific studies confirming that if you regularly consume soybeans as part of your daily diet, all of these symptoms will significantly decrease and become much less severe compared to women who do not take them at all. These beans. But it's important to note that if you have estrogen-dependent tumors or a history of breast cancer, you should only consume soybeans after consulting your doctor. The fourth step you need to take care of is stress. Given that estrogen is in short supply, stress triggers all the aging processes. And here, it's especially important to start slowing down, doing breathing exercises, taking walks, meditating, and spending time in silence. Basically, anything that helps restore your nervous system. And of course, sleep. Dear women, I've told you about the 4 steps that every woman needs to take during menopause. Of course, there is also a 5th step, but it comes with its own risks and side effects. This is hormone replacement therapy, specifically estrogen. If you take estrogen, it can fully compensate for the loss of your endogenous estrogen. This will be a powerful preventive measure against aging of the cardiovascular system, skin aging, improving metabolism, and strengthening your bones. But the problem is that hormone replacement therapy is believed to increase the risk of malignant diseases. Although there are scientific studies showing that the risk is insignificant, it increases the chance of developing breast cancer by 1 in 1,000. But still, contraindications for this therapy include the presence of any tumors. That's exactly why you can't just go to the pharmacy, buy estrogens, and start taking them on your own. Yes, you can do this if prescribed by a doctor, but it's very important to monitor your progress. The most suitable candidate for hormone replacement therapy is This is a woman under 60 years old who has clear signs of menopause and who has no contraindications such as tumors in the reproductive system, malignant diseases, liver problems, or heart failure. And such women can take hormone replacement therapy for 5 years or even longer and maintain their youth. But of course, the risks may increase as well. Therefore, if you want to do things in the most natural way possible, and if you are truly willing to work on yourself, the first 4 steps can significantly address all the negative effects that may appear during menopause. Want to lift your face and tighten body? I invite you to my rejuvenation course. Link in description below. Don't forget to subscribe to my channel, stay tuned for new episodes, and see you next time.